Okay, so I want to book an appointment with a gastroenterologist to promote Gastrazole. This one looks good, Abdel Rida. I'll just email him and hopefully we'll be able to meet tomorrow at 3 p.m.
Yes, come in.
Good morning, Dr. Abdel. How are you?
How are you? I'm fine.
So, my name is Ali. I'm a medical representative, and I came here today to present to you my drug. It's called Gastrazole. It's basically omeprazole. But just before I present to you, first of all, I have a presentation here. If you can take 10 minutes of your time.
Yeah.
If I can take 10 minutes of your time to represent
Okay.
this.
Good.
So Gastrazole here, omeprazole. As you can see, for the product overview, first of all, let's talk about the company. You have European Egyptian pharmaceutical industries. It's basically like an Egyptian company producing high quality, affordable, generic and branded medications. They focus on therapeutic areas like gastroenterology and cardiovascular health and pain management, adhering to international manufacturing standards. AAPI serves Egypt and nearby regions such as like the UAE and Saudi Arabia, and to make healthcare more accessible. So basically, my drug right now that I'm gonna be showing you is Gastrazole, omeprazole, 20 milligrams.
Okay, that's good.
So basically, since it's omeprazole, you should know that it's a proton pump inhibitor used to reduce stomach acid, treating conditions like acid reflux, GERD, and peptic ulcer. It works by blocking acid-producing enzymes in the stomach, promoting healing of the esophagus and the stomach lining.
Okay.
Gastrazole 20 milligram is commonly used for short-term treatment and symptom relief in adults.
So the duration is short, for short duration.
Yes, it's used for 4 to 8 weeks because that's how most PPIs are, because they cannot be used for more than 8 weeks. So for Gastrazole, this is like the advantages for Gastrazole. It's effective for chronic GERD and peptic ulcer. For the treatment, you take it once daily, so it's like very good for daily use.
Yes.
Only 4 to 8 weeks of treatment duration, and available dose is 20 milligram. For the FDA approval, it's approved for gastroesophageal reflux disease, GERD, peptic ulcer, and NSAID-inducing ulcers.
Yes.
So this is the competitor overview. We have a competitor called Nexium. For the active ingredient, it's omeprazole for Gastrazole, as you can see, and esomeprazole for Nexium.
Okay.
Mechanism of action, they're both the same since they're both PPIs. They block the proton pump in the stomach. And for the indication, they're both for GERD, peptic ulcer, and for the dosing, 20 milligram once daily. Meanwhile, the Nexium, 20 milligram or 40 milligram once daily. So for the efficacy, highly effective in reducing stomach acid since it's a GERD medication. And for the Nexium, provides sustained acid control. For the unique benefits, like Gastrazole, since it's like very cheap, it's very affordable for the patient, and it's widely available in most pharmacies. And for Nexium, it has a higher dose availability, so it has 20 milligrams and 40 milligrams. And it's better for like severe cases. And as you can see, the price for Gastrazole is about 22 dirhams in pharmacies. It depends on the pharmacy. And for Nexium, you can find it at around 184 dirhams.
So is Gastrazole cost effective comparing with Nexium?
It is, yes, it is cost effective, and it has the same, basically the same effect as Nexium, but at a way cheaper price than Nexium.
Okay.
So it's more affordable for the patients. This trial shows that study objective aimed to evaluate the safety and therapeutic efficacy of omeprazole 20 milligram taken once daily. It shows compared to placebo, of course.
Mm.
So study type, it's double-blind, multi-center, randomized controlled trial. For the participants, the trial induced patients with healed duodenal ulcers. Specific inclusions criteria included individuals who had successfully completed 4 weeks of treatment for duodenal ulcers, and the duration, as for the study, is 48 weeks or 1 year exactly. For the efficacy, omeprazole was found to significantly reduce the recurrency of ulcers during maintenance therapy when compared to placebo. For the safety profile of omeprazole is generally favorable. It doesn't have that many side effects, but it's very minimal side effects, which is as I said, nausea and vomiting.
Mm-hmm.
And for the conclusion, omeprazole was effective in preventing the recurrence of duodenal ulcers with a favorable safety profile. The study supported the use of omeprazole for short-term maintenance therapy in patients who have healed from duodenal ulcers.
Okay, I have a question regarding, and you said that the medication is only taken once daily.
Yes?
Is it during the breakfast, then dinner, or the lunch?
It's just right after breakfast if you want.
Okay.
So it lasts the entire day and it will treat the...
So only once a day?
Once a day, that's it. That's why it's a good medication.
Yeah, good idea.
Yes. This is a graph that shows the placebo versus gastrazole taken. So as you can, or omeprazole.
Can you zoom a little bit?
Like this.
Yeah.
Hold on. It doesn't zoom anymore. Okay.
Yeah, it's fine.
So it, as you can see, placebo is right here in the dotted line. Meanwhile, here you can see omeprazole 10 milligram and 20 milligrams. So as you can see, 20 milligrams is way higher than placebo. And here as well, as you can see, and with
So do we start the dose by 10 or 20?
No, we start with 20 since gastrazole only has 20 milligrams. It doesn't have 10 milligrams, but it just shows you the difference between 10 milligram and 20 milligram.
Okay, that's good to know.
That's it for a conclusion. 20 milligram of omeprazole gastrazole demonstrates significant efficacy in treating GERD and peptic ulcers with superior outcomes compared to placebo in clinical trials. From a pharmacoeconomic standpoint, it offers a cost-effective treatment, reducing long-term complications and the need for more expensive interventions. Its established market presence combined with its affordability and proven benefits makes gastrazole a valuable option for both patients and healthcare systems.
So, okay, that's good to know.
That's it.
But you said that the patient will take it for 4 to 6 weeks, I guess?
For 4 to 8 weeks, yes.
For 4 to 8 weeks. Okay, after that, if the patient didn't get well from the ulcers?
Well, it's most likely they will get better from that if they use the drug correctly, if they adhere to it. They're most likely gonna do it, but if they don't, then they have to use another drug because maybe maybe an H2 antagonist will be better, but it usually works.
Okay, that's good to know. So
that's the sample of the drug if you want to take a look.
Okay. Thank you.
That's it?
Yeah.
So what do you think?
I think it's good. That's good. I will try to prescribe it to my patients.
Yes.
Who are suffering from GERD and peptic ulcers also and sale ulcers. That will be a good try to try that.
Yes. Thank you very much.
Thank you.
Thank you for taking your time.
No problem.
Okay. Thank you.